If you're a gentleman over the age of 60, I'm about to share something that might surprise you, but it's important that you hear it. Your prostate could be growing, and not just a little, but quite rapidly, due to 3 common habits you may think are perfectly fine. These habits do more than just cause minor discomfort. They rob you of your sleep, your vitality, and your sense of independence. And if you don't address them promptly, you could be headed for surgery, catheters, or even worse, losing control over a function that every man takes for granted until it's compromised. I'm Dr. Anya Sharma. For more than 30 years, I've been helping men who are experiencing the same challenges you might be facing right now. Waking up several times each night to urinate, feeling anxious about your bladder during meals, and experiencing a loss of intimacy because your body simply doesn't feel the way it used to. My intention isn't to frighten you, but rather to offer guidance. Many men assume that prostate growth is simply a consequence of getting older. But what if I told you that the real reason has less to do with your age and more to do with how much time you spend sitting, how late you drink fluids, and the foods you eat every day? In this video, I'm going to reveal the 3 most common habits that are secretly causing inflammation in your prostate, and I'll share how you can reverse years of damage without medication, surgery, or having to give up the things you enjoy. These aren't just general recommendations, they are specific, scientifically supported actions you can take starting today. And it's crucial that you pay close attention because the second habit is one that almost every man believes to be healthy, yet it's actually one of the most detrimental to your prostate. Let's dive in. Before we get started, please subscribe and click the notification bell so you'll never miss important advice that could safeguard your prostate and your overall well-being. And if this message resonates with you, please type 1 in the comments. If it doesn't, type 0. I'm always striving to improve, and your feedback is valuable. Okay, let's begin with the first habit, which is something most men do every day without giving it a second thought. It seems harmless, even typical, but over time, it subtly puts pressure on your prostate, setting the stage for inflammation, discomfort, and frustrating urinary issues. Habit number 1. Sitting for extended periods without moving. The silent presser. Let me share something I've witnessed countless times. A man comes to my office, intelligent, successful, retired, or nearing retirement. He's in his 60s or 70s, perhaps. He's frustrated, not sleeping well, waking up 3, 4, sometimes even 5 times a night just to urinate. He can't even sit through a movie without needing to get up. And he says, "Doctor, I don't understand it. I eat reasonably well. I don't think I'm doing anything wrong." And that's precisely the problem. He's not doing anything, he's sitting. We often underestimate how much time we spend sitting, whether it's watching television, reading the newspaper, driving, or simply relaxing. Many men over 60 spend the majority of their waking hours in a chair. It feels harmless, you've earned your rest. But your prostate doesn't perceive it that way. Here's what's actually happening. When you sit for prolonged periods without getting up, you're applying constant pressure to the muscles and tissues surrounding your prostate. It's like slowly squeezing the same area for hours, day after day. Over time, that pressure restricts blood flow, stiffens tissues, and increases inflammation in the pelvic region. I call it the silent presser because you don't feel it happening until the symptoms manifest. And when they do, they're not always immediately severe, perhaps a slightly weaker flow, a little more urgency. Waking up once at night turns into twice, then 4 times. Before you realize it, you're planning your life around the nearest restroom. Your body starts to feel unfamiliar, no longer dependable. There's also a hormonal aspect that's often overlooked. When you sit for hours every day, your body produces less testosterone and more estrogen. That hormonal shift, even if subtle, directly affects prostate tissue growth. It's a gradual progression toward benign prostatic hyperplasia, or BPH. And the most concerning part is that it's often mistaken as simply a part of aging. It's not. It's related to lifestyle, and it's reversible. I had a patient named Carl, 67, a former engineer. He used to spend 5 or 6 hours a day sitting in his recliner watching cable news. When I explained how his sitting habits were impacting his prostate health, he was astonished. We didn't implement any drastic measures, no medications, no procedures. I simply asked him to stand up and walk around the house every 30 to 45 minutes. Within weeks, his nighttime urination decreased from 5 times a night to just once. He described it as life-changing, all because he literally stood up for his health. So, what can you do today? It's simple. Set a reminder on your phone to stand up every 30 minutes. Walk a lap around your house. Do some gentle stretches. If you're able, take a short walk outside after meals. This isn't about strenuous exercise, it's about circulation, about keeping blood and oxygen flowing freely through the pelvic region so your prostate isn't constricted by inactivity. If you think that sounds too easy to be effective, I understand. But sometimes, the simplest habits are the most powerful. You don't need to completely transform your life overnight, you just need to start moving again consistently. Your prostate will appreciate it, and so will your bladder. Now, if that surprised you, just wait until you hear about habit number 2. It's something almost every man believes to be healthy, something even I used to recommend. But when done at the wrong time, it can quietly make your nights miserable and your prostate inflamed. Let's discuss it. Habit number 2, drinking too much water at the wrong time. The nocturnal disruptor. Let me ask you something. When was the last time you had a full night's sleep? I mean, truly slept through the night without waking up even once to use the restroom? Many men I speak with can't even recall. It's been years. They just assume it's a part of aging, that they're destined to wake up at 2 a.m., 3 a.m., maybe even 4 a.m., shuffling to the bathroom, exhausted, frustrated, and wide awake when they should be resting. And most of these men, good men, are doing something they believe is healthy. They're drinking water, lots of it, staying hydrated, just as their doctors advised them, but they're doing it at the worst possible time, and it's disrupting their prostate function, their bladder control, and their deep sleep. I remember one patient, John. He was 71, very health conscious, walked daily, ate a clean diet, and drank at least 8 glasses of water a day. He'd gulp down 2 glasses with dinner, another before bed, sometimes a little herbal tea to wind down, and then he'd wake up 3 to 4 times a night without fail. He thought it was simply his age, but when I asked him when he was consuming all that fluid, his expression changed. He had no idea the timing mattered. Here's the truth that most men never hear. It's not just how much you drink, it's when you drink it. As we get older, the bladder becomes more sensitive, the muscles weaken, and the communication between the bladder and the brain becomes less reliable. Add to that an enlarged prostate pressing against the urethra, and it doesn't take much fluid to cause nighttime urgency. Drinking large amounts of water, tea, juice, or soup after 6 p.m. sets off a chain reaction. The bladder fills overnight, pressure builds, and you wake up repeatedly. And each time you do, your body loses precious deep sleep, the kind that regulates hormones, restores energy, and helps your prostate recover. The worst part is that it becomes a vicious cycle. Poor sleep lowers testosterone, low testosterone encourages prostate growth, and a larger prostate leads to more nighttime urination, and so on. What I tell my patients is simple. Drink plenty of water, yes, but prioritize your hydration earlier in the day. Consume most of your fluids before dinner. Sip throughout the day, and stop drinking 2 hours before bedtime. And skip the nighttime tea, even if it's herbal. Some herbs are natural diuretics. They push water through the kidneys faster and make matters worse. Your bladder needs rest just as much as your mind does. John made just one change. He stopped all fluids after 7 p.m. Within 2 weeks, he was waking up once a night instead of 4. After a month, some nights he didn't wake up at all. His wife said he was less irritable, and he had more energy during the day. And most importantly, he felt like himself again. That's the power of timing, not a pill, not a surgery, just providing your body with the conditions it needs to function properly. Now, if you thought that was eye-opening, just wait until you hear about the 3rd habit. This one involves what's on your plate, and it's something millions of men eat every single day, not realizing it's promoting estrogen production in their bodies, quietly fueling the very prostate growth they're trying to avoid. Let me show you what it is. Habit number 3. Consuming too many estrogenic or inflammatory foods. The prostate promoters. There's something important I've learned over 3 decades of treating men's health issues, and it's this: what you eat either soothes your body or inflames it. There's no middle ground. Every bite is either healing you or gradually working against you. And when it comes to your prostate, the foods you're eating every single day might be quietly fueling the very problem you're trying to resolve. I've had countless men come to my office frustrated, tired, and overwhelmed. They tell me they've tried the medications, followed the routines, even stopped drinking fluids at night, but they're still struggling with frequent urination, that uncomfortable pressure down low, and that feeling that something just isn't right. And often, when I ask them to describe what they eat each day, I see the same red flags appearing again and again. You see, most people think of food as fuel, but certain foods act more like hormones. They can trigger the body to produce more estrogen, yes, even in men. And they can inflame the tissue around the prostate, causing everything to swell, tighten, and become harder to control. These are the foods you find in nearly every kitchen: white bread, sugary cereals, processed meats, cheese, beer. All of them seem harmless on their own, but over time, especially when combined, they shift the internal chemistry of your body in ways that make your prostate more vulnerable. Refined carbohydrates spike insulin and promote systemic inflammation. Processed dairy is often loaded with hormones that can mimic estrogen. Beer, in particular, contains phytoestrogens from hops, and when men consume it regularly, they don't realize they're actually tipping the hormonal scale toward imbalance. I remember one man, Frank, 66, who came in feeling completely defeated. He said, "Doctor, I'm doing everything right. I quit smoking, I go for walks, I even meditate, but I still feel swollen and uncomfortable down there." When I asked him what he ate, he told me every morning started with toast and orange juice. Lunch was usually a sandwich with deli meat and cheese. Dinner often included pasta or pizza with a beer. Nothing excessive, right? But when we took a closer look, his diet was full of inflammatory triggers: no vegetables, no fiber, no foods that help flush out excess estrogen or calm inflammation. So, we made a few simple swaps. He started eating more cruciferous vegetables like broccoli and cauliflower. He added tomatoes for lycopene, pumpkin seeds for zinc, and replaced the white bread with whole grains. We didn't count calories. We didn't make it complicated. And within a month, Frank said something that stayed with me. He said, "For the first time in years, I don't feel like my body's working against me." That's the truth about food. It's not just nutrition, it's communication. It tells your body what to do, how to feel, and whether to promote or reduce inflammation. So, if your plate is full of things that make you feel bloated, heavy, or tired, it's time to listen to your body. Start making one small change today. Your prostate won't respond overnight, but it will respond. And speaking of change, if you've made it this far, there's one more piece I need to share with you. One final habit that can help you turn all of this into action starting tonight. It's not about restriction. It's not about discipline. It's about one simple plan you can follow today to start reversing years of damage. Let me show you how. 4. What you must do today. The turnaround plan. Let me speak candidly for a moment. After working with thousands of men over the years, I've learned that the biggest breakthroughs don't come from new medications or sophisticated tests. They come from something far more powerful: a decision. A man reaches a point where he says, "I've had enough. I want to feel like myself again." And that decision, that moment, becomes the turning point. So, I want to ask you, why not make that moment today? Because now you know the truth. You know the hidden damage that sitting for too long can do to your prostate. You know how drinking too much fluid at the wrong time can rob you of restful sleep and strain your bladder. You know how inflammatory, estrogen-rich foods can quietly fuel prostate growth day after day. So, the question now isn't what's wrong, it's what you're willing to do about it. And the good news is, it doesn't have to be complicated. Start by picking just one thing to change today. That's it. Not 5, not 10, just one. Maybe it's setting a timer to stand up every 30 minutes and walk around your home. Maybe it's deciding to stop drinking fluids 2 hours before bed. Maybe it's swapping out white bread for whole grain or adding a handful of pumpkin seeds to your lunch. These might seem like small things, but they're not. They're signals to your body that healing is possible, that you're no longer fueling the problem, but starting to shift toward the solution. I remember a man named Howard. He was 73 when he first came to see me. He was the kind of guy who had given up hope. He had a drawer full of medications, slept in a separate bed from his wife because of constant nighttime urination, and he told me, "I just want to feel normal again." I gave him the same advice I'm giving you now. Don't aim for perfection, just do one thing today. He chose to move. Every morning after breakfast, he walked 2 laps around the block. That's it. Over time, we added small dietary changes. He started drinking his water earlier in the day, Slowly, the frequency of his bathroom trips decreased. He started sleeping better. His confidence returned. And when I saw him 6 months later, he said, "Doctor, I finally feel like I'm living again, not just managing symptoms." That's the turnaround I want for you. Not a list of rules or restrictions, but a real, lasting shift in how you feel, in your body, in your energy, in your sense of control. You've made it this far into the video, and that tells me something important. You care. You're not passive. You're ready. And now that you understand the hidden habits that may be fueling your prostate issues, the only thing left is to begin. And in just a moment, I'll leave you with a final message, one that every man over 60 needs to hear. Because the truth is, this journey isn't just about your prostate, it's about your peace of mind, your freedom, your dignity, and how you can reclaim all of it. Starting now, let's wrap this up together. Conclusion. Final thoughts from Dr. Sharma. If you've stayed with me this far, I want to thank you sincerely. That tells me you're the kind of man who doesn't ignore the warning signs. You're willing to listen, to learn, and most importantly, to act. And that matters more than you know. Because the truth is, millions of men over 60 are suffering in silence, thinking frequent urination, poor sleep, and discomfort are simply a part of getting older. But they're not. They're signals. Your body is communicating with you, and now you finally understand what it's been trying to say. We talked about 3 silent habits that gradually undermine your prostate health: sitting for too long without moving, the pressure and stagnation that restricts circulation and promotes inflammation, drinking too much water at the wrong time, disrupting your sleep and stressing your bladder, and the everyday foods that act like estrogen or inflame your tissues, causing the prostate to swell quietly over years. But we didn't stop there. I showed you how to turn things around starting today, not with a long list of rules, but with one simple, powerful shift: your decision to begin. And if you're wondering, is it too late for me? Let me say this from the heart. No, it's not. I've seen men in their 60s, 70s, even 80s completely transform their prostate health, their confidence, and their freedom by making small, consistent changes. You don't have to be perfect, you just have to begin. Your body is capable of healing, your energy can return, your nights can be peaceful again, and you can feel strong, steady, and clear. So, wherever you are in this journey, whether you're just noticing symptoms or you've been dealing with them for years, this is your moment. Don't wait, don't wish, just start. You've got the knowledge now, and you're not alone. I'm here to guide you every step of the way. Let's move forward together. If this video helped you understand your prostate health better, please give it a like. It tells me this kind of content is valuable to you. Share it with a friend, a brother, or anyone over 60 who needs this message. Leave a comment below, even just a thank you or a question. I read every one. And if you'd like to support this channel and help us create more doctor-backed content for men's health, consider making a small donation using the link below. Every bit helps, and I'm deeply grateful for your support. Let's continue to make health simple, honest, and powerful together.